Dear participants, dear guests, dear colleagues and friends, I would like to welcome you to this important event organized by the European Brain Council on Brain Awareness Week 2024. Your continuous awareness-raising initiatives are instrumental in promoting brain research with the ultimate goal of improving the lives of millions of Europeans living with brain disorders, both neurological and mental. Although due to other commitments I could not join you today, I would really like to thank everyone for joining in, and I'm trying to contribute with this video message. The brain is in fact the most complex organ in the human body, and understanding how the brain works, how brain diseases progress, and finding treatments and cures for these diseases is really a long-term crucial commitment. Brain research and innovation must therefore be recognized more than ever as a priority for health and research in the EU, supporting the development of a European Brain Research and Innovation Plan, which combines research and public health initiatives to address brain functions and disorders in a comprehensive manner, must be a priority for the policymakers. The 179 million citizens in Europe living with a form or several forms of brain disease need a structured response. In fact, 970 million people worldwide are living with a neurological disorder. These numbers are alarming without considering that they predate the COVID-19 pandemic, which we now know it led to higher rates of mental health conditions and neurological complications caused by the COVID-19 itself. So good mental health is widely and unquestionably recognized as an essential part of a person's well-being, with an important impact on all aspects of life. To mitigate the burden of mental disorders and improve the quality of life, it is essential to address its determinants: the physical and natural environment, living and working conditions, education, and the capacity of the system to respond to health, welfare, and social needs by providing accessible and quality services are all factors that can profoundly influence mental health. Moreover, the most common mental disorders, such as depression and anxiety, are often linked to social and economic insecurity, job scarcity, and poor housing conditions. At the same time, it is essential to consider the impact of European and national policies on mental health. I think we all agree on the fundamental role of the mental well-being as a component of a productive, sustainable, and healthy life at home, at work, at school, and in social life. This applies to a specific category of population even more: children and adolescents, so the younger part of society. In the age of uncertainty in which we live, young people are increasingly exposed to fears and worries for their future, often with negative consequences on their mental health. It is sufficient to say that a person born in the early 2000s has already been through a great recession and the resulting austerity measures, a global pandemic that has triggered social isolation, the loss of family members, and the disruption of daily routines, such as the simple fact of going to school, and geopolitical conflicts, costs of living crisis, and a world coming to terms with the extent of the climate change and environmental degradation. So the recent increase in the impact of mental disorders in young people is a signal we can no longer ignore. In Europe, we must say clearly, the suicide is still the fourth leading cause of death in the under 20 population. It's really a tragic number. Any EU health strategy must involve and engage all relevant actors and sectors, including parents and families, youth organizations, cultural and sporting institutions, and this multifaceted approach would only be more effective but also more inclusive and reach the most vulnerable or marginalized groups of young people if put in place properly. So I want to conclude by endorsing the manifesto for the 2024 European elections, No Health Without Brain Health. I think it's very clear in its message. Brain disorders must become a national, European, and global priority through the policies I've been discussing in this message I just recorded for you, to achieve greater benefits for those directly affected and for society as a whole. Thank you for your attention and see you soon.